I'm Dr. Kaiser, and I currently work as a hospitalist and a nephrologist here at Columbus Regional Health. Today, I'm going to be talking about sepsis. Sepsis is a disorder that occurs when your body has an abnormal response to infection. And your body typically has several lines of defense to be able to fight off those infections. The first line of defense really is an intact skin. So your skin cells themselves form a barrier that prevents kind of invasion, if you will, from things like bacteria or fungus or viruses. If, though, those invaders would make it through your first line of defense, we actually then have a second line of defense called your immune system. And you can think of this like your armed forces. They're there to patrol and protect and make sure that that bacteria or virus or fungus doesn't set up a site of infection. The main sort of army of that would be called the white blood cells. And the white blood cells go throughout the bloodstream and are looking for those signs of infection. If they find infection, they can actually then release what are really like tiny weapons of destruction, and those are used to destroy the bacteria. These are things like antibodies or chemicals called cytokines. We actually then have what I would consider a third line of defense, and that is really when you seek care through your healthcare provider. Your healthcare provider may diagnose an infection and then prescribe an appropriate antibiotic for bacterial infections or antiviruses or antifungal medicines. Again, when we're talking about sepsis, what we're talking about then is a disorder that occurs when your body has an abnormal response to this infection. So instead of just fighting off the bacteria or the viruses or the fungus, unfortunately, your body may then start sending these chemicals that could hurt your own cells. And you can think of it as almost like friendly fire. So those chemicals can then turn around and damage your cells, and one of the main spots that we'll see is that it can damage the cells that line the blood vessels. That can lead to problems with low blood pressure, and it can lead to problems with both bleeding and clotting that can occur throughout your body. Other organs, though, can be damaged. People can have difficulty breathing because of the damage that can occur in your lungs. People can have difficulty with their kidneys or their liver as those cells become damaged. We can certainly see damage to the skin and the tissue, and unfortunately we can also see damage that occurs throughout the entire body and leading to something that we would call multi-organ system failure. And in fact, that can lead, if it becomes progressively worse, to death of the patient. One of the questions that I'll often hear people ask is, how does somebody get sepsis? And basically anybody who has an infection is at risk for sepsis. We do know that there are people that are at a higher risk for sepsis than others, and those are patients who are greater than 65 years of age and also those who are less than 10 years of age. We know that patients who have chronic diseases are at a higher risk for infection, and that can be things like chronic kidney disease or chronic liver disease, people with chronic lung disease, people who have AIDS, and people who are receiving chemotherapy for cancer. Anytime there is a break in the lines of defense, you're at an increased risk for infection and therefore an increased risk for sepsis. So that if you have a cut or a burn in your skin, that can increase your risk that you can get an infection. Also, people who have abnormalities in their lungs can get an infection, and the most common cause for that would be smoking. That impairs the ability of the tiny cells that line your lungs to sweep that infection out. We also know that if you have any problems with your immune system, you can be at a higher risk for infection. So again, people who have cancer that are on medicines that can suppress their immune system, or certain diseases that in themselves can cause immune problems, such as AIDS or HIV. The biggest risk factor, though, for sepsis is any type of infection.